we had to basically stop what we were doing. Like every business, we laid people off, we furloughed. Um, we quickly started to understand how to try to do telemedicine. It's difficult when you do spine for a living. You have to do a neurologic examination. Not every time, but it's very risky to not examine a patient when they have a neurologic issue to determine if they have weakness or a reflex loss or something that you can't just pick up on the telemedicine. So, but for follow-ups, reviewing their MRI, looking at their results from testing, it's been great. But we kept working. We had a number of patients who had neurologic issues. All of us who do spine surgery had to move patients through the operating room. Now, there was fear from the hospital, fear from the patients, but we were able to do these urgent cases that needed attention successfully. The hospital set up guidelines, and it gave confidence to both sides that we could do this without everybody getting sick, and the hospital could do two things at once: focus on COVID and still take care of the patients that needed surgery. So that has built up, I think, into the current situation where it's sort of like a holding pattern. We're doing surgeries, the operating rooms are functioning, but they're ready, quote unquote, for the next wave. So I think we're in a much better space. The issue of like people staying at home and being caught on Zoom meetings, I don't know if it's more difficult on their back and neck compared to their psyche. The people I talk to, I mean, I get to go out, right? I get to come to the office or go to the operating room. And so, but some people have not been back in the office. I mean, I don't know what, for 8 months now. And they're doing meeting after meeting after meeting after meeting, like these Zoom meetings, which is what we're doing right now. But if you're a business person, you basically finish one, you go to the next, and they're doing these like relentlessly. So I think there certainly is a problem of patients being sedentary. The underlying pathology that we see, that brings people into surgeries or spinal injections, tends to be either a long-term degeneration problem that occurs over decades, or an abrupt injury. Something happened. They went lifting, they got injured in sports, they did something in the garage, and boom, then they're off, to this injury. So the sitting and being glued to the computer is not helpful, but I haven't seen per se like a group of patients. Maybe 12 to 18 months from now, they'll trickle in. But right now, we've been really good at balancing the telemedicine, and we've also been alternating our staff so they're not all in the hospital on the same day, and getting the patients in. The fear factor among patients is going down, but there's still a lot of patients who just will not come in for the care they need, and those are the patients who I'm afraid of, rolling in, 3 to 6 months from now, when they should have been in here maybe 3 to 6 months earlier with neurologic issues that we can't help that might be permanent now.